Monday morning. Time for Renown's Health and Wellness segment. And on the phone with me, this go-around cardiologist with Renown Institute for Health and Vascular Health, Dr. Frank Zalman. Good morning.
Good morning, Dave.
Let's talk about hearts and heart failure. It affects nearly 6 million Americans. Roughly 670,000 people are diagnosed with heart failure each year. What is congestive heart failure?
Well, it's one of those illnesses that sneaks up on people, and it's when when the person's heart muscle doesn't pump enough blood so that their lungs can get enough oxygen. Then they get filled up with fluid, and so they can get edema, a swelling of the legs, they can get short of breath, they get fatigue, they get tired. And the good thing about it is that we have the right tools to diagnose it, like an echocardiogram, and we have great medications nowadays that can actually change the course of the disease. So the important thing is if a person has symptoms, to contact their physician, and if they're here in Reno, of course, at Renown, we can certainly make the diagnosis and then start the appropriate treatment.
That's great. What are some symptoms and how is heart failure diagnosed?
The first thing that we're looking for is to find out if the patient gets short of breath or fatigued with the usual activity. So anything unusual in terms of energy level that is persistent, not if you just have a little bit of fatigue, but if it just doesn't let you do what you want to do. The other thing would be shortness of breath out of the blue or when you're lying down. So then, of course, with a good physical and a good history, the next step usually would be some blood tests and then an echocardiogram, which is like an ultrasound of the heart, sort of like what they do for babies, when a person is pregnant, and we look at that, then we can do the same thing for the heart, and we can see it beating in real time. And so it's like a radar, and we can see the heart muscle, and when the heart muscle is not working appropriately, the heart function is decreased, and that can lead to heart failure.
Exactly how can heart failure be prevented?
Well, that's another excellent question. One of the things that you want to do is avoid having a heart attack, of course, because damage to the heart muscle can go that way and cause the heart failure. Others, a virus can cause heart failure, and so sometimes we don't have control over it. Eating too much salt that leads to high blood pressure, and uncontrolled high blood pressure can lead to heart failure, so it's very important to control the blood pressure. So there's many, many ways to develop heart failure. So one of the things to do is just take precautions and see your doctor regularly, and just use common sense. Not overdo things. Even too much alcohol can lead to heart failure.
If you'd like to learn more about heart failure, Dr. Zalman is going to do a free online health series on Thursday, June 13th at noon. To register, visit renown.org/online health series. Thank you so much for joining me this morning, Doctor.
Thank you so much, Dave. I appreciate the time.